So to kick off orientation, Dr. John Finnegan, the Dean of the School of Public Health here at the University of Minnesota, I'd like to introduce him. So Dean Finnegan holds both an MA and a PhD in mass communications that he earned here at the University of Minnesota. He began his public health career in 1980, following a first career path as a journalist during the 1970s. As a doctoral student, media professional, and later as a public health faculty, he was a member of the pioneering research team here at the University of Minnesota that developed the Minnesota Heart Health Program. Based on this initiative, Dean Finnegan launched a career specializing in the role of communication in mass media and leveraging change in health knowledge, behavior, and public policy in the context of community campaigns to improve public health. Today, Dean Finnegan serves on the board of Health East Care System, Health Partners Research and Education Institute, and the Backyard Initiative Community Advisory Board. He also serves as board chair for Children's HeartLink and past board chair of the International Association of Schools and Programs of Public Health. So please help me welcome Dean Finnegan.
Okay, first thing I have to do, selfie. Okay, here we go. Okay, I got here. All right, that's good, that's good, that's good. Okay, I got you all. Fabulous. Well, good morning, everybody. Thank you guys so much for being here today. It is one of the two best days every year for me from the standpoint of what we do here at the University of Minnesota. And this is one of the... And what's the other one? Commencement, absolutely right. So I'm delighted to welcome all of you here and also to get a sense of how many of you are from Minnesota, not from Minnesota, or from international other countries. And all I can say is that to begin with, I want to compliment you on your extraordinary judgment in coming here to the University of Minnesota School of Public Health. You have made a terrific choice, even if I do say so myself. You are at one of the premier institutions of public health in the nation, and we do pride ourselves on a rich history of community ties, as well as our rich history of global health as well. I'm going to tell you a little bit more about that in a minute, but for those of you who are not from Minnesota, I think that you will find living here in the Twin Cities metropolitan area and in the state in general, it's a very thriving, diverse community, and I think you're going to find that there is something for everyone here, and I promise you that will be the case even in January and February. Okay, so keep that in mind. You're going to hear from a number of people about the School of Public Health today, and all of us that are going to present to you share a very firm commitment in making your educational experience the very best that it can be. And you're going to be taught by faculty members who have national and international reputations. They are leaders in their field and worldwide. And you're going to find that our classrooms and our libraries are fully equipped with very fine technology that will aid you in your learning. And you also have already met a very dedicated staff. And that staff in particular is, I think, just one of the best in the university. The concern that they have for you, the quality of their support for you is going to be very important to create this best learning experience that we can. The best part about them is that you can approach them and they will actually answer your questions. So please do not hesitate. If there's something you're not sure of, you don't know about, there are no stupid questions. We might give you stupid answers, but there are no stupid questions, so just keep that in mind. So one point that I do want to make to you about your relationship here with the school, and that is that we want this to be a lifelong relationship. We know that you are here for a brief period of time, a few years, fewer years if you're in the master's program, longer years if you're in a doctoral program. But it, of course, started when you began to consider Minnesota, and we hope that it will end long, long down the line. We would like you to think of us as a lifelong partner in your continued education and learning. So that's very important for us, and you are going to hear also from some alums as we go along. So I do want to talk to you a bit today about a bunch of different subjects. I'm going to kind of bounce around a little bit, but just to give you a very broad 30,000-foot orientation to the school, to the field of public health, and various and sundry things that come into my mind. Well, public health. It is big picture. It deals with big challenges, and it deals with big solutions. And as you probably know, we are part of an academic health center. We've got medicine, nursing, pharmacy, vet med, dentistry, allied health professions, and public health. And there is a tremendous resource here in all things health. How do we differ from medicine? Well, mostly our focus is on that big picture. It's on the solutions to grand challenge problems, and you're going to hear more about that from a speaker that will follow me very shortly. So when we talk about public health, we really say that our focus is about populations and communities. It's about the environment, many environments, human-made and nature-made. And it's also about systems, above all systems, whether those are human-made or nature-made. And it's about a whole variety of methods and tools that we use to understand the world around us when we think about prevention and when we think about promoting health and wellness. So we often will talk about ourselves as a research to action field or set of fields. We talk about discovery. And discovery can lead us to applications, better practice, public policy, outcomes of various kinds. And all of those together end up creating 21st century public health impact. So, today, public health is collaborative. It is transdisciplinary. We need everybody working on challenges in public health. We need design and architecture and engineering. Everybody has a role in public health. It's interprofessional. As I mentioned, all those other professions, every profession, even law, business, all of these professions, all of us have an obligation to deal with the common good of public health. We cross sectors. It's not about government alone. It's about public, about private, it's about NGOs, it's about every sector working to solve and address the challenges of our time. And if you've been looking at the newspaper or television recently, you know exactly what we're talking about. It's also global. Everything that happens in the smallest village of Africa needs to be of concern to the smallest village in Minnesota. As you will hear from our next speaker, there are pathogens and there are emerging infectious diseases we never dreamt 50 years ago that we would ever see in Minnesota. But the world is a different place than it was 50 years ago in the 20th century, and certainly it was different than the 19th century. Okay, now, those of you that are not from Minnesota, that might be from Minnesota, I want to tell you a little bit about the state, kind of introduce you to it a little bit. The first animal life in this neck of the woods happened here about 500 million, half a billion years ago. We were underwater here, deeper than Houston, I can tell you. And that shallow sea gave rise to some of the very first life. And if you have a chance sometime and you happen to be looking around the banks of the Mississippi River, you may find traces of that life. It's in the form of fossils, shells, coral, brachiopods, all those wonderful things. Those were the first residents of Minnesota. This land that we are on was land that humans have walked on for between 12,000 and 15,000 years. The ancestors of today's American Indian tribal communities came here at about the time the last glaciers were melting and moving northward. It was called the Wisconsin Glacier at that time, in our time. It wasn't called back then. And those folks that came here came over that Bering Sea Bridge, came down this way into this area that we now know as Minnesota, right at the end of the last ice age, and they were hunter-gatherers. They were moving around hunting the game that existed at that time. Minnesota comes from the Dakota language, and the land that this university is on was home to the Dakota for millennia. And that language gave us the name Minnesota Makoche. I apologize to those of you that know Dakota. My pronunciation is not exactly perfect. But when you translate that literally, it comes out, the land where the waters are so clear they reflect the clouds. Now, Sota in Dakota has blue to it. So once upon a time, somebody created a beer in Minnesota, and they said Minnesota was the land of sky blue waters. Well, that's actually not a bad translation. I admit it's more of an advertising slogan. So this is the map of Minnesota, and I have some interesting facts for you. Minnesota has about 5.5 million people as of 2016. That's a relatively small population given the states we have, but it's an enormous landmass. In the metro Minneapolis-St. Paul area, it's about 3.28 million, which is 59% of the total population. And the state itself is about 87,000 square miles, or, if you prefer, 225,181 square kilometers. We are the 12th largest of the 50 United States. As a nation, or as a state, we are as large as the nations of Laos, Uganda, or Romania. And believe it or not, within the state boundaries, you could fit Belgium, Netherlands, Slovakia, and Switzerland. If you crushed them all together, the residents wouldn't like that, but if you did that, they would all fit within the boundaries of the state of Minnesota. So, we have, you've heard Minnesota called the land of lakes or the land of 10,000 lakes. Actually, it's 11,842. I didn't count them. I'm relying on Wikipedia here. And these are lakes of greater than or equal to 10 acres in size. Now, where are you? You are right here in the Twin Cities metro area. This part of Minnesota is one of my favorite parts. It is a lot of wilderness, and it joins with the Canadian wilderness. It's the Boundary Waters Canoe Area Wilderness. It's over 1 million square acres, and it gets even bigger than that when you add the Quetico, which adjoins it in Canada. If you like canoeing and if you like being off-road, because there are no roads or anything in that particular area, it is a wonderful place to go. And I think it's the largest contiguous area of its kind in the lower 48 states. This is what it looks like. One of my favorite places. Wonderful trails, wonderful place to canoe. But there are so many beautiful places in Minnesota. This is just one of them. But any place you go, you're going to have a good time and you're going to learn something new. So if you want to know more about the state of Minnesota, you might take a look at these two books. North Country, The Making of Minnesota, published in 2010. Terrific. It really takes a look at especially what happened in Minnesota when European settlement began in the 17th century. And then The Land of the Dakota by Bruce White and Gwen Westerman will tell you a lot about what we know of the ancient tribes as well as the Dakota and the Anishinaabe tribes. Literature. Has anyone ever written about Minnesota? Well, you probably know some of our famous authors. F. Scott Fitzgerald, August Wilson, the playwright, many, many others. But one that you might not know about actually was written about some of what goes on right here near the university campus. And it's a book called The Boat of Longing by Ole Rolvag. And it really tries to capture the emigrant experience in Minnesota. What you're looking at there is a photograph under the Washington Avenue Bridge. And this was an area called the Bohemian Flats. And if you were a poor immigrant coming to Minnesota, that's one of the neighborhoods you would live in. If you're an immigrant coming to Minnesota, when my grandfather from Sweden came, he lived in that area and then up on the cliff, which is where the Cedar Riverside neighborhood is. And so today, our Somali neighbors live in that area as the most recent group coming to Minnesota, which enriches our culture every time new groups come here. So that book is really worth reading if you want to learn a little bit about it from a literary standpoint. And that's what the Bohemian Flats looks like today. That's what it looked like in 1910. This is what it looks like now. Keep this in mind. So many generations before you have walked this ground. So many generations before you have tried to find their futures here and have contributed to building the futures of their communities. You are yet another. Any place that humans try to do that to me is sacred ground. Think about yourself in that long line of generations trying to make this a better planet, a better state, and a better place. All right, a little bit about the University of Minnesota. We were founded in 1851, and yes, we were here before the state of Minnesota was here. Minnesota became a state in 1858. In 1851, we believed that education was more important than government. Some of us still believe that. But the point is that this university, higher education as a future for the state of Minnesota, was extraordinarily important and still is to this day. All right, I have a quick quiz for you. When Minnesota became a state in 1858, it chose the motto, Les Trois du Nord. This translates, for many are cold, but few are frozen. Land of many cultures, mostly throat. Protecting Ontario from Iowa. Sorry if you're from Iowa, I know Mike is. Or Star of the North. And if you're a good French speaker, you know that it was protecting Ontario from Iowa. No, sorry. A little background in history. We're pretty sure that Charles Hewitt was probably the first faculty member ever appointed to a university in this country as a teacher, a professor of public health. And he was appointed the non-resident professor of public health here at the university in 1874. Fascinating to me. There were 3 states that had state boards of health. The first 3 states, Massachusetts, California, Minnesota was number 3. And our friend Dr. Charles Hewitt, who moved to Red Wing back in those years, was the first secretary of that state board of health. And an amazing individual. This house, which still stands in Red Wing, just down the road here, 216 Dakota Avenue, is a public health landmark. Why? Because that's where he lived, and that's where he also helped to create vaccines, such as for smallpox. Okay? And he also created the very first statewide epidemiologic network looking for infectious and communicable disease that we could respond to rapidly in a day when we didn't yet have telephone, but we did have telegraph. So almost every physician in the state of Minnesota and every small town was deputized in some way to assist that. And Minnesota got a reputation very early as a state that cared about public health. Well, we didn't get around to establishing a school of public health until 1944, and Gaylord Anderson was the man who did that, a physician who also held a doctorate in public health from Harvard, and was also chair of the Department of Preventive Medicine and Public Health in the medical school. and a friend of the Mayo brothers. And when the Mayo brothers passed away, it was a bequest from their estates that actually helped to establish this School of Public Health. And you probably will notice the Mayo name in a variety of places. Mayo Auditorium, the Mayo Building, which is where many of us hold office. And at the same time, I get to hand out Mayo professorships of public health, which is something that's come down from the very beginning. Dr. Anderson served in World War II, and while he was gone, the acting dean was Dr. Ruth Boynton. You will notice Boynton Health Service. Well, Ruth Boynton was a physician, a researcher, and an administrator, and she kept the place together while he was gone and began the growth of the School of Public Health that we know today. An amazing individual. Here's another individual that has contributed a lot to the school. Leonard Schumann, a physician and public health researcher. He founded the Division of Epidemiology in the early 50s. He established the first PhD in epidemiology. It came from Leonard's work out of this school. Just amazing. Leonard served on a variety of polio, various kinds of projects. He was a very interesting epidemiologist because he did both infectious and chronic disease. Today you don't find that very often, but in those days he was one of those people that was at home in either side of epidemiology. He served on the U.S. Surgeon General's report on smoking, and yes, he was a smoker. And he told this great story on himself that when the Luther Terry's Surgeon General in the 60s, 1964, when they presented the report to the world, he was there. And when he got home from this big deal, he went out in the garage to have a smoke, and all of the cigarettes he had out in the garage were gone. And he asked his wife, "Dear, where are my cigarettes?" And she said, "You know, I saw the film of what you guys have found out on TV. You're quitting." And he did, no question of it. Ansel Keys, founder and director of the Laboratory of Physiological Hygiene, did the very famous human starvation studies. Any of you been in the United States Army or military and eaten K rations? The K stands for Keys. He and his wife, Margaret Keys, introduced the whole country to the Mediterranean diet beginning in the 60s. Jim Hamilton, founder of one of the first degree programs in hospital administration in the USA, which is now the Masters of Health Administration, founded here in 1946. John Kralewski, a health economist, founded the division the Center for Health Services Research, which was a forerunner of our Division of Health Policy and Management. And Environmental Health Sciences, a history that goes back into the 30s. And eventually, under Herbert Bosch, it became a department within the School of Public Health. Biostatistics, the fourth of our units. That actually started here in the 20s. Finally, in the 50s, it became a unit within the School of Public Health, and Jacob Bierman was one of those first directors of biostatistics who started to train an enormous number of biostatisticians, which we desperately needed in those days. We stand on the shoulders of giants, and this is your leadership team. From the divisions on the top, our 4 leaders, and our deans on the bottom there, including yours truly. We owe a huge debt to all those people that have come before. So these are all the colleges in the University of Minnesota, and the ones I've circled are in the Academic Health Center. But I will tell you, there is not a college up there that public health does not have a relationship with in some way, shape, or form. So take advantage of that while you're here. Take advantage of the richness and the depth of what you have here in the Academic Health Center and at the University of Minnesota. And lastly, welcome home. Whether you're from Minnesota or not, welcome to your new home. Thank you very much.